أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم اللهم صل على محمد وآل محمد. Today inshallah al-Aziz, by the grace of Allah Almighty, we are going to discuss another disease of the horses, which is named as exertional rhabdomylosis. This is basically the disease of musculoskeletal system. Exertional rhabdomyolysis is also called as azoturia, number 2 Monday morning disease, and number 3 tying up. So these three names have been given names have been given according to the severity of the disease. Azoturia actually the name for severe form of the disease. Monday morning disease is the disease which occurs after the horse has been rested for a day or more, which in the working horse is after the weekend. And tying up, number 3, this appears to represent a milder form of the disease. Milder form of the disease is called as tying up, and if a horse has been given a rest for one day or more due to any problem, due to any managemental problem, due to any injury or something else, so that horse may suffer from Monday morning disease. And if the disease is more severe, then that is called as azoturia. In this disease, actually the color of the urine becomes dark brown, dark black, you can say. This is due to the presence of hemoglobin in the urine. Clinical signs may be divided into two forms: mild cases and severe cases. And before discussing the clinical signs, we must discuss about the etiology. Etiology: cases can be seen at any stage during an exercise period. It is frequently seen when training is interrupted by the weather, or training is interrupted due to any injury or some managemental difficulties, or in endurance horses after extreme exertion. Now come to the clinical signs. Number 1, mild cases. Mild cases show stiffness of the muscles, perhaps transient stiffness of the muscles, and there may be gait abnormalities as well in mild cases, and there is no discoloration of the urine in mild cases. But in severe cases, animal or horse is reluctant to walk or unable to move. Number 2, muscle stiffness is also there, but with severe pain as well, and tremors are also seen, and spasms, they are also observed during severe cases, in particular in the muscles of the back and hindquarters. So mainly in exertional rhabdomyolysis, when disease is severe, mainly back muscles and hindquarter muscles, they are involved. And next clinical sign which we can observe is elevated pulse rate and elevated respiratory rate. Next clinical sign, very important in this case, is called as discoloration of the urine. Urine may be red brown to almost black. Red brown to almost black color indicates the presence of myoglobin in the urine. We are discussing about the exertional rhabdomyolysis in horses. Now come to the diagnosis. For diagnosis of this exertional rhabdomyolysis, there are three main methods. Number one is called taking of history. Number two, presenting clinical signs. Number three, laboratory confirmation. So we can confirm this disease from taking number one by history, number two by clinical signs, number three laboratory confirmation. So far as the diagnostic aids are concerned, there are three main diagnostic aids which we can take for confirmatory diagnosis. Number one is blood chemistry. Number two is urine analysis. Actually, these two main things are there to confirm exertional rhabdomyolysis. So far as the blood chemistry is concerned, two main enzymes are checked in the blood. Number one, creatinine kinase enzyme level, and aspartate aminotransferase enzyme level is checked for the diagnosis of this exertional rhabdomyolysis. Usually in this disease, the level of the creatinine kinase enzyme increases up during first 12 hours, and then it becomes normal up in 24 hours. And if the level of this enzyme do not go down, if the level of this enzyme is not going to down in the blood, it means that there is severe problem. Aspartate aminotransferase enzyme rises more slowly and take 10 to 12 days to return to the normal. Next is urine analysis for the diagnosis of the exertional rhabdomyolysis. For this purpose, reagent dipsticks may be used to detect the presence of myoglobin and hemoglobin in the urine. Visible changes in color if myoglobin exceeds 40 mg per ml. It means that if in the urine the level of myoglobin exceeds from 40 mg per ml, then please inform the owner about the severity of this problem. Next is the treatment. How to treat the horse which is suffering from the exertional rhabdomyolysis or azoturia or tying up disease. So first of all, administer a non-steroid anti-inflammatory drug, NSAIDs, which are called as NSAIDs. Example of NSAID is phenylbutazone or flunixin. Anything which is available in the market, including this phenylbutazone or flunixin, that may be used as an NSAID to treat this exertional rhabdomyolysis. Second, we should go for fluid therapy and electrolyte therapy. Fluid therapy includes lactated Ringer's solutions intravenously may be given, and oral electrolytes can also be used in this regard. Number three, larger doses of corticosteroids, 40 to 60 mg betamethasone, can also be given intravenously to relieve from the shock conditions. So three things have been discussed so far as the treatment is concerned. Number one, NSAIDs have to be administered. Number two, fluid therapy and electrolyte therapy. Number three, larger doses of corticosteroids, they are used. And next, number four, vitamin B and vitamin E and selenium may also be used to assist the treatment But these things should be used in recovery phase, not should be used in earlier phases. Vitamin B, vitamin E and selenium combination should be used in recovery phases. Number 5, walking exercise should be done. And number 6, high fiber diet should be used for the horses in exertional rhabdomylosis treatment. Prognosis. Recovery should be monitored by serial serum enzyme levels. This should determine when it is suitable to return the horse from limited walking to exercise, and it may take 2 to 3 weeks. The return to the work should be at a lower rate than previously and must not be too soon. So horses should not be given so much exercise, so much workload after recovery from this disease, because if they are going to have more work after this disease, then the repeated episodes may be seen in the horses. Repeated episodes of this exertional rhabdomyolysis may further more damage the muscles, and horses will not further be used for the purpose for their main purpose. So prognosis is better if the carbohydrate intake is kept as low as is compatible with conditions and satisfactory performance. And if we want to keep the horse away from this disease, and if we want that horses should not suffer from this disease, then dietary supplementation with vitamin E and selenium should be used as a prophylactic measures. So as a prophylactic measures, we should use vitamin E and selenium in the diet of the horses. So this was a little bit about exertional rhabdomyolysis, disease of musculoskeletal system of the horse. Inshallah, we will come with the next disease of the horses very soon, inshallah. Thank you very much. Allahumma salli ala Muhammadin wa ali Muhammad wa ajil farajahum.